But in women, we can't afford to lose muscle mass and we can't afford to lose bone. And I really worry we're going to have a generation of people who have taken these that are going to get to their twilight years and be breaking their hips by sneezing.
This teenager once weighed an astounding 800 pounds. You heard right. The 19-year-old from Bradford, Pennsylvania lost an incredible 470 pounds.
When I gave my heart to Jesus and surrendered over, there was a peace. From 799 pounds to 600 pounds down, this isn't just weight loss. This is a podcast to rebuilding your spirit, your mind, and your life. Welcome to the 600 Pounds Down podcast with me, Coach Justin. Welcome back to the 600 Pounds Down podcast. Today I'm honored to have Dr. Jill Owens with me. You know, Dr. Owens is a medical doctor. She's a fellow of the American Academy of Family Physicians. That's an honor. That's amazing. And the owner and CEO of Bradford Family Medicine. And today we're going to be talking about modern medicine, natural health, and kind of that truth in between. I've always been somewhat interested in hearing a different perspective, because I'm in the health and wellness field, and all I hear online most of the time would be people saying, stay away from medications, stay away from your doctors, they're evil, they only get X amount of schooling on this topic, they don't know health, all these things. And so I wanted to bring on a guest that I've known for quite a while. She was my doctor at one point and really have a ton of respect for. And I believe that she takes modern medicine, she takes natural health, and she brings a good balance to that. And she's not biased on one or the other. And it's cool because we're going by science here. We're going by what we've seen, what she's experienced from her patients, and of course, what she has studied. And I'm honored to bring her here to the 600 Pounds Down podcast. Ladies and gentlemen, Dr. Jill Owens.
Thanks, Justin. Great to be here.
Yes, phenomenal. And I'm thankful because I know you have a very busy schedule. You have a lot going on, don't you?
All the time. Lots of balls in the air all the time. Wouldn't have it any other way, though.
When you said yes, I was like, she really said yes. I was stoked about it. I was telling my family, I'm like, yeah, we have Dr. Owens on. It's going to be great. But I know our listeners and you're based out of Bradford, Pennsylvania, and I was born and raised there. And again, you were my doctor at one point and totally respected you, totally respect you still and your views. And I just want to have our Bradford listeners especially be listening to this because we're doing this thing together and we're going to bring some education across your ears. So hopefully you can leave here with a balanced view and some of your questions answered. Dr. Owens, I want to start off by just asking you your background in the medical field. And even so, like what got you attracted to that particular area?
So interesting. I also grew up here in Bradford, so I was adopted as a kid. A lot of people know that story of mine, which we'll do for a different show. But after about 6 weeks of life, was brought to Bradford and have been here ever since. So it's home to me as well. I went to medical school because when I was about 11 years old, my grandmother had a heart attack. She was actually, our family raised beagles, and a lot of the Bradford connection know that. One of them got loose one day and my grandmother was out trying to chase the dog down. Happened to be my dog. But anyway, she had a heart attack while she was doing it and ended up in Erie, having a heart bypass and was very sick. In fact, at one point they didn't think she was going to make it through. So I was up there visiting and I remember going into her ICU room. Actually, Dr. Zone, who was one of the old hammock cardiologists, took me by the hand, took me in, knew I was very concerned. And my grandmother was kind of my person when I was little. So it's certainly a very concerning moment for me and took me by the hand and helped to kind of just ease my fears, show me what things were going on and explain it in a way that it wasn't just to an 11-year-old kid he was talking to. He was really telling me how he was fixing things and a little more intricate than, maybe the average person. And I thought to myself, someday I'm going to be able to do that. And, planted the seed. Never really thought that I would execute, I guess, at 11. But over the years, I kept that focus and really, over time, more and more life experiences led me to want to do that. Now, of course, I went to school at Pitt, undergrad and med school, and when I was in med school, I thought I was going to be a heart surgeon or a cardiologist, just like Dr. Zone and some of his colleagues that saved my grandmother. But over the time and the experience there, I ended up thankfully getting a rural family medicine rotation with a dynamite doctor who did everything. She delivered babies, she took care of little kids, she took care of their grandparents and great grandparents, she did minor office surgeries, and I spent 4 weeks with her. At the end of the 4 weeks, I just couldn't see myself doing anything else. So much to the chagrin of my advisors at Pitt, who thought I was going the surgery tract, I shifted gears completely and went into family medicine. Anyway, the rest is history, but I haven't looked back. And the thing that attracts me to that is just the holistic approach. You know, you're taking care of entire generations of families, which I have tons of families here in this area that I take care of and still actually identify me as their doc, even though I'm not actively seeing patients day to day, which is kind of fun. And I know them so well and their histories, and it just makes you a better doctor because you know what their families are going through. And oftentimes it gives you that little edge of how to communicate with them that may make an impact where otherwise a regular 15-minute visit, you'd never have that opportunity.
Yeah, yeah. You know, my parents actually still go to Bradford Family Medicine as their primary care there, and they always say, like, that's their doctor, Dr. Owens' office. They always say that, even though they see Caitlin, they say, you know, or Allie, which is always good. You have a good staff there, and it's so incredible. I just really appreciate that in the Bradford area. But that's quite an event, witnessing your grandmother go through that, and then, you know, it's like, when you see that, it definitely sparks an interest to how can I prevent something, even at a young age. You kind of know, like, hey, this isn't good. This is not normal. The panic button begins. And then all of a sudden, sometimes in those panic moments, our passion is birthed. And I've seen that in myself when I had to lose all the weight. Like, my passion became birthed. At first, I was like, oh, this is crazy. But as time went on, I was like, man, I have to do this or my life is on the line, and it wakes you up. And now I just bring the message of health, weight loss, and so on to everyone who's willing to listen. But going into where you're at, family medicine, I think that's a fantastic avenue to go to, because it's not just seeing one problem. You know, you're not just doing a cardiology, you're not just you're not doing pulmonary, you're not just doing, you know, hematology, right? You're actually kind of all over the map. Now, not would you call a specialist in particular areas, but able to help somebody find the right avenue that they need to go to as a doctor. And you're seeing the whole person, and like you said, even whole families, which is remarkable. And that's something that some medical professionals don't get to see. So I really commend you for that. What has that taught you when, I know you said you get to see the whole person, you get to see people throughout the community, but like, what is this profession in family medicine? What has that taught you over the years as a doctor?
You know, I think just the impact that you make. I remember, and this was early in my career, probably 25 years ago, I was sitting in an exam room and I'd seen a patient 6 months before, and she came back in and literally verbatim read me about 2 sentences that I had said to her, word for word. It was a little scary, you know, 6 months prior, and I thought to myself, oh my gosh, like, this cemented in her brain, and that's now become one of the things that she takes with her on her journey through health. And I thought, my gosh, you know, now I have to pay attention to what I'm telling patients, because they're really taking this to heart and living by it. Now, that's can be a curse maybe, but it's an opportunity too, because if people have that much faith and trust in you that they're taking your words, you know, shame on us if we don't do a good job with what we're doing, because we have the ability. And I think that's one of the reasons why I think doing this, I never miss an opportunity to educate patients on how to take care of themselves and how to live the lifestyle that goes along with their health and things. And so I think just to be able to be the person that has that kind of impact is amazing. And, you know, you mentioned the family aspect to it. I think that's one of the reasons why my practice has been so successful. And even to this day, without me in there and the doc, you know, Dr. Stupak and Caitlin and some of the others working with patients, you know, we put the family first, and we make sure that the decisions we make are the same decisions we would want somebody to make for our parents or our kids or our spouse. And so that really, I think if you approach decisions with that as your background, you can't go wrong, because you're going to do the right thing every time.
Yeah, I love that. That's so good. You're actually you're selling the facility, the Brad Family Medicine, very well right now, and you're
We
probably gonna
don't
have an
need any
uptick of
more
people.
patients,
So,
by the way, so sorry. I don't
are you taking new patients?
know. I think we're completely closed down at
Oh
the moment. I'm
man.
looking for another provider, another physician, or APP, and once I get them in there, we'll open back up. But yeah, it's we do a good job, so hopefully soon we can do that.
Yeah, that's awesome. That's great. So there's a waiting list. All right. I do want to talk about your personal life when it comes to your health. Now, you witnessed your grandmother having a heart attack, and you have developed this passion to help people by becoming educated in the medical realm, if you will. What has that done for you with your own personal health journey? As you know, 600 Pounds Down is a health podcast, and we do talk about the health of the individuals in mind, body, and spirit. Now that you had this awareness from 11 years old and on of health, how has that impacted your lifestyle in health and wellness?
Yeah, good question. I think through the years that's changed. When you go to med school, you learn about the intricacies of the science behind everything and the pathophysiology behind diseases. And unfortunately, and I'm sure we'll talk about this in a little bit, but you learn more about diseases than you learn about health and wellness. Throughout my life, I've struggled with my own weight and trying to maintain things, and not as bad as a lot of people do, but if I were to eat what I wanted and not exercise, I would not look like what I look like, and it takes me a lot to get here. So, it's combining the two and finding that balance, I think, has been the key for me. So, taking the things I've learned in medicine and then also listening to the struggles of others and trying to figure out the best approach for everybody. I think for me, I've found that there is no one right answer. So, you get online and you see, okay, if you just do this, you'll be perfect. Or if you just take this shot, or if you just do this medicine, or if you just live this lifestyle, or if you don't eat between certain hours, or whatever. I could list 1,000 different things. If you do those things, you'll be fit and you'll look like this. And they show you a picture of this, supermodel.
Are you tired of not knowing how to lose fat for life? Are you tired of being addicted to food? When was the last time you actually looked in the mirror and said, I like what I see? Listen, my name is Coach Justin, and I've lost 600 pounds. I use the methods that I've learned over the course of the past 16 plus years to help people shed fat and gain life. This is your opportunity to change your life forever. You'll want to sign up for 600 Pounds Down coaching, and you can email me at onestepnation@gmail.com. That's onestepnation@gmail.com. Email me and say I'm in, and we'll connect and have a discovery call to change your life. Now go get it and don't waste any more time.
Those things may all work, but you've got to find something that fits, that you can make a lifestyle. And so I think for me, that's where I've kind of found the balance. And that's over the last few years here, especially kind of shifting my career goals to do more of that focus with patients instead of just illness care is fun. And ironically, I'm doing hospitalist work now. And so I'm doing a lot of illness care, and I do like working people through those crisis points like I witnessed with my grandmother. But it would be great if we could prevent people from getting there. And that's really the bigger success story. You don't get a medal for that. Nobody's going to send you a thank you card, but that is the bigger success story. If we can get our patients to eat healthy and exercise and live the healthy lifestyle and take care of themselves mentally and physically, that's where you don't see them then for the crisis points as often, if ever. So.
Yeah, it's really sad because we live in such a culture today where everything that feels good you do, right? So the unhealthy food and convenience, let's be honest. I mean, and as you get older and you have your elderly patients, normally they don't really cook for themselves. Their cooking looks like, hey, a frozen TV dinner or something, or let's go out and grab, something at the restaurant, and they're fried in seed oils and high omega-6s, and they're not getting that ratio omega-3, omega-6. They're not eating the healthiest foods because a lot of our restaurants aren't equipped with that. And a lot of the cheap foods, if they're on a budget, especially Social Security, different things like that, they may not be able to afford healthier foods at times. Now, I do believe healthier foods can be affordable. However, you have to be very cautious and plan accordingly, because if you don't, you're going to buy a bag of cereal from Magic Spoon that costs you $9. Like, number one, it's probably not the healthiest thing anyway, but a little bit better than Frosted Flakes, if you will. But still, okay, you don't have to get that. We can get some other items instead, right? Plan accordingly. Now, just to ask you real quick before we move on to the next topic, What does your lifestyle look like? I mean, I know it kind of sounds like you're eating a whole foods approach, sounds like you're eating healthy, natural most of the time. And kind of give me an idea what you're at with that and what's your exercise routine look like.
Yeah, so progress over perfection for me.
Love it. Love it.
Because I'm not perfect by any stretch. Exercise every day, and even on my rest day, I still go for a walk or do something. I try to stay physically. And so in women, especially women, guys too, active all day, every day, as much as possible. My work is sedentary, it makes it tough, but I try to be as active as I can. A huge proponent, especially the last few years here, of lifting and lifting heavy. I think and again, we'll probably talk about this down the road, Ozempic and some of the GLP-1s came on the market, there was this push, to use them a lot. And they do have a role medically, which we'll talk about, but if you're not lifting and lifting heavy and building your muscle, that's the first thing you're going to lose, and that's going to be the most substantial impact on you. And that's what drives our metabolism, it's our muscle mass. And so if you lose muscle mass, that's why all these people gain weight after they stop them, is because they don't have the muscle mass. So I've incorporated that in. And again, if you were to ask me 20 years ago, I would have said, oh, I hate weightlifting, and I still hate it. I still hate every second. But I've developed a routine where 3 days a week I do full body activity. And again, over the last couple of years here, I've refined that. For a while, I was just going in the gym, and I have a Peloton subscription and a Peloton treadmill for the wintertime, and I was just getting on there and doing a full body workout for the day. And I was finding that it was just haphazard and random where I was at, not bashing Peloton. I love them and I still use them every day, but I need a set group of muscles I'm working every day for my 3 days a week. So
Peloton, listen up.
Yeah. So I do, I actually created on the Peloton app my own little workout, and I do that three days a week. And then, so again, those who know me know I've done marathon, and I've done a lot of half marathons and running, and I used to do a lot of distance running, which was great because I joke with people, someday I'm going to have to run a marathon to maintain my weight. And then I found that wasn't enough, and I'm like, oh my God, now what am I going to do? So I've totally shifted gears, and I'll throw a plug in for Marianne Kale, who's a nutritionist friend of mine, one of the best by far. Years ago, she actually told me, you need to quit running. And I'm like, Marianne, if I quit running, I'm going to be 600 pounds. I can't. And she's like, no, trust me. If you focus on your muscle building and stuff. And so slowly over time, I've incorporated that. And she's absolutely right. So, to get your metabolism going, so the weightlifting 3 times a week, I do run occasionally still because I enjoy it, believe it or not. And so, but just not the long distance miles and things. And again, being active. I try to sleep good. That's another thing. So at different points in my life, I haven't needed a ton of sleep. But now as I'm getting older, 7 to 8 hours, I need it. And I wasn't always focused on making sure that I got it. Now I do. I make sure that if I'm working it and I have to be up at 4 a.m, I get to bed on time and get my 7 to 8 hours so that I can get up in the gym at 4 and then be to work by 7. So it's just one of those things, I think, and one of the things I talk about a lot to patients is consistency. So again, I'm not perfect at all. I'll miss a day here and there, or I'll go out. In fact, I was just at a family friend's funeral over the weekend and did not eat well for a day. Wasn't terrible, but I tightened it up the next day, and never miss 2 workouts, never eat 2 bad days. I try to keep that in my mantra as I'm going forward.
Love that. And you touched on the progress over perfection, which I think that's one of our top fundamentals here, foundational pillars would be progress over perfection. And realistically, if you look at it, it helps us so we're not getting burned out by something, right? So yeah, if we're at a picnic or something, try to have the self-control. They'll have 3 things. Just like, okay, we'll have the protein, we'll have hey, this looks good, we're gonna have this dessert, and then try to keep it from there. Take it and just say, this is great, and accept it and just say, I enjoy this food. I love your approach. I love that you're consistent on your exercise, and I love that you talked about resistance training, because it seems to be, it was previously for many years a man's thing to get into the gym and lift weights, right? And you'd see women once in a while, and they'd be intimidated most of the time because, man, you see these guys grunting and, all the things like popping veins, and it's like that would be intimidating for some people. But then more and more research is coming out, and it's being exposed that weightlifting, especially going a little heavier, not just your little 2-pounders, if that's heavy for you, that's okay, but something that's challenging is going to really help you metabolically. And also, it's been shown muscle is a longevity organ. So I'm really excited to hear that you maintain that And our listeners, please listen. Resistance training, ladies, it's not just a man's thing. And Dr. Owens, let me ask you a question. We're going to move on, but are you getting totally bulky like a muscle fitness person, or are you? Let's talk to our ladies about that real quick.
No, I'm absolutely toning up. I am not getting bulky. In fact, that was my excuse for years because I hated it. I'm like, yeah, I don't want to get bulky. So it was just my excuse, but because I knew better. But, no, I'm toning up and looking better. My clothes are fitting better. That's really the key behind it. And like I said, muscle is metabolism. So, if you want to boost your metabolism, especially for those of us who've done years of cycle dieting, yo-yo dieting, and you've killed your metabolism pretty much, this is a great way to build it back up because you build your muscle mass, which then boosts your metabolism and naturally helps you get back. That's why you don't need to do as much cardio, because you're actually, if you look at your basal metabolic rate and take out your cardiovascular exercise, you burn way more calories with your basal rate than you burn in that hour or whatever it is that you do your cardio. So that's the exercise you want to focus on, building those muscles so your basal metabolic rate is faster and your metabolism's faster and you're burning those calories when you're just sitting, doing something non-exercise related. Yeah.
Love that. So good. All right. Well, that put a pin in that, guys, because that's a great, go back and re-listen to that because it'll get you onto the right track. Now, let's move on and let's have a conversation about how medicine has changed over the years, or maybe has evolved over the years. Can you tell me when you first started practicing to today, tell me some of the key differences from back then to now? Like, I know we see the GLP-1 agonists. I know we see doctors pushing a lot of Lipitor or cholesterol medications. We see a lot of that stuff. So is this because these things have been shown to really work well for people who are struggling with cholesterol issues, weight issues from excess fat in the body, obesity related issues? Tell me how things have evolved from previous to now. How do we stop you have to have this medication first versus life medication, like lifestyle medication, right? Preventative medication, if you will. Tell me a little bit about that. How's it evolved? Where's it at today? And is it going in a good direction? Kind of give me an answer on those things.
Okay. So when you ask the question first, other things jump to mind that have nothing to do with medicine whatsoever. It's just how the profession has changed. But again, maybe a topic for a different show.
No, go ahead. Hit on that. I think that's important.
No, I don't think that's gone in a good direction. I think from the doctor and the patient and developing the care approach or the treatment approach that's right for that patient to administrating healthcare. So your dollars now in healthcare are going to fund a system of bloated administrative stuff that has nothing to do with the actual care of the patient. And same thing is true in the pharmacy industry. It's true with nurses. It's true with doctors. It's true with everybody. So that's, when you first asked that, I'm thinking that's the answer I'm going to give you. But I get what you're talking about. So with medicine in particular, and how has it changed? So certainly in the United States and a lot of the Western society, research has developed protocols for diseases that are showing excellent results. Take cancer, for instance. Some of the newer biologic agents out there for cancers are getting survival rates that we've never seen before. So, and I always think of the guy, I always want to say Steve Jobs. I think it was it Steve Jobs that, tried the natural approach and then passed away? Yeah. So, I think he proved that doing the natural route, sometimes not always the best route, because natural stuff, and again, we'll talk about the balance issue in a bit here, but doesn't always have the science and the data behind it to prove that it works. And so you're taking a chance, you're taking a risk. It's just like investing. If you're investing your money, if you have no idea if this is a crapshoot, you're probably not going to put all your money into that stock or whatever it is you're investing in. But if you know that this is likely to be a solid investment with some safety, you're going to invest in that. Same thing is true in medicine. So we have data behind some of the things that we use. And medicines like Lipitor and the other statins have data behind them too. So, and that's one of the good things is evidence-based medicine. And I'm a firm believer in evidence. If you have evidence that it works, you should be using it. I think part of what has blown medicine up, especially post-COVID here, is that sometimes the evidence is tweaked a little bit to show the results that you want it to show. And I'm not saying all science is junk. If I had a heart attack tomorrow, I'd be taking aspirin and Lipitor without a doubt, probably a beta blocker too, because there's good data to show that that helps me prevent another heart attack and helps, things along the way with that disease course. Same thing if I got cancer. There's excellent data to show that certain types of chemotherapy or the new biologic drugs work, and I would be taking one right off the bat. Like I said earlier, though, the prevention is in the key. And so one of the things that always has frustrated me as a physician is people will say, you're a doctor, you just want to push medicine. But, you're bought out by the drug companies. Well, I wish I missed the train where they passed out money to the doctors. So apparently everybody else got it. I got nothing from the drug companies to do this. So I think I got a couple of pens, maybe a tablet here and there, maybe a dinner, but certainly they have not supported my lifestyle in any way. And yet people kind of see it now as, okay, as a doctor, your MD, you're going to prescribe drugs to me. I would much prefer my patients do the lifestyle changes at the front end to prevent these diseases so that they don't end up getting there. Now, can you prevent heart disease completely? No. Can you ward off cancer and never have an issue with it? No. But you can certainly lower your risk by living a healthy lifestyle. And there's good data to show that now, too. So if you eat certain vegetables and if you have an active lifestyle and things like that, even things like dementia, Alzheimer's disease, stuff like that, there's good data to show that you're less likely to get those diseases if you're living a healthy lifestyle. I'd much rather have people start there. But once you get there, it is hard. And I'll tell you, as a hospitalist now, the other end I see is people who are very geriatric, in their 90s. And, you get these nursing home patients that are on 40 meds. And there's good data to support all of them. But you're thinking, oh my gosh, these got to be interacting, and some of them probably causing more side effects. And so then you start peeling away. I had a great mentor in residency that would just slash away those drug lists for her nursing home patients and be like, they're 98, they're demented, who cares if they have another heart attack? We're getting rid of the Lipitor, we're getting rid of the aspirin, we're getting rid of this. And, I kind of find myself in that balance too. If I was that patient, I wouldn't want to keep taking those things either. I would want to live my life and do the best I can, and whatever end finds me at that point. So it is about kind of balancing and making the right choices. But I think, so if to answer your question, I guess to put a exclamation point on it, if I was a patient and had a disease and there was good data to support the medication, I would take the medicine. If there was good data to support an herbal supplement, I would take the herbal supplement. And if there was good data to show how I can prevent those things, you better believe I'm probably already doing it. So, that's where I would be with
That's
health.
good. I like that. I like the balancing act. The topic of cholesterol medications or statins. That's one that I feel is pushed very often. And research that I've witnessed, and I'm not a doctor, but more and more research that I do on this from professionals that I've witnessed or talked to and also have listened to, a lot of times these statins really don't always need to be given. And do they really do exactly what they think they're doing right now? Like I heard today, I think this was on a Dr. Mark Hyman podcast. Again, I don't take everything as gospel truth, but just listening in, the number one reason that they're kind of concluding, they had 3 different cardiologists on there talking, and one of the things that they said was interesting, statins, it's not necessarily about the cholesterol lowering outcome of it, but more about the inflammation response that comes from that. So lowering the inflammatory response in your cardiac health markers could potentially be the thing that's saving you, because the verdict's out there on cholesterol really being the only culprit to somebody developing heart disease over time. Studies have shown that there might be some tie-in with that, but there's other studies that show that doesn't matter so much, and it might come down to particle size. It might come down to your ApoB, or it might come down, there's a lot of variations. Your CRP, you name it. But do you feel like, and then we're going to move on to the next topic, when people are hearing these things from other doctors or online or from health nutritionists or whatever, and they're going a natural route, has there been more of a challenge on prescription drugs to patients and patients challenging the doctor on that? Is there a challenge that's happening more often, you feel?
Yeah, absolutely. In my 26 years as an attending physician, over the course of that span, it's gotten, progressively steeper curve of the patients who come in with data that they found online give you feedback of why they are or aren't going to do what you said. And so definitely. And I'm not all opposed to that. Again, I am fine. I want patients to be educated and do research. You do have to be careful online. I told you earlier, I've struggled with my weight my entire life. And there are some things on there that, I want to be like, I'm clicking purchase and I'm going to buy that supplement and I'm going to take it and I'm going to be skinny tomorrow. And I know better because I know none of those things are going to do that. So, you have to be a little careful because the research you're reading online is biased by folks typically. If you find a good randomized placebo-controlled blinded study that compares two different things and it shows the data beyond a reasonable doubt that lines up behind one side, then I think you can support it. And again, Lipitor and some of the other statins have that behind it. Now, you mentioned inflammation. We definitely know there's more to it than just cholesterol by itself, because I've had patients with cholesterol in the 500-600s and their LDLs are well above 200 and they don't have a heart attack and they live a long time with those numbers. Whether they take a statin or not doesn't matter, they're still living a long time. So there's way more to it than just your numbers. However, inflammation best responds to things like your diet and doing an anti-inflammatory diet, which if you happen to look what's in an anti-inflammatory diet, it's the non-processed whole foods that you should be eating anyway. Again, I think it all comes back to, if I had a heart attack though, I would be taking a statin. So and that's with the knowledge that I have about the studies that show that it stabilizes the plaque, it also lowers the cholesterol amount to be contributing to those plaques, and it does make a difference in your morbidity and mortality from heart attacks and strokes going forward. So I think, again, you have to take the data, and it is hard, like I said, as a consumer myself, you see stuff online and you wonder, geez, is that right? But that's where, so put it to a study, and I'd love to see that done and say, okay, if you don't take your statin, you do an anti-inflammatory diet, maybe the anti-inflammatory diet alone would be better. It might be. But for me, I would take the combo and do them both and give myself the best chance at a good outcome until we know better. And that's the other thing too, in science, the studies that prove out what they prove out, the data sometimes changes. Estrogen is a good example of that, right? So I've been through the entire roller coaster of that in my career. So it was first, everybody gets estrogen. You'd go through menopause, here's the tablet, take it. And then we went through a phase where it's terrible for you, it kills everyone, we should never use it because it causes breast cancer, heart attack, strokes, all these things. So nobody got it. And now we're back to the other, well, some people can take it and safely take it. And so again, but that's all from doing some randomized placebo-controlled trials to show what makes a difference and what doesn't. And depending on how you set them up, sometimes you can guide the results a certain way. So you really want to see some unbiased stuff that gets to the meat of the issue.
That's a good answer and explanation for sure. We're living in a society today where it's important that the consumer or the patient will challenge. I have seen two sides to every story when it comes to patient and doctor care, physician care. I've seen doctors who think they know it all and don't really care about the patient, and literally just takes what they've known scientifically from what they were taught and say, nope, this is your end-all say-all answer. And then the patient fires a doctor because it's like, I can't deal with that. On the other hand, I've seen doctors say, this is a warning shot to you. The cliff is in front of you and there's a fire. You need to do this or else you may not live. And people deny that and end up passing away or having some bad things happen. So again, there's that middle road. But I think the one thing people can do is do your research and find a doctor that you trust. That's what it comes down to as well. Like somebody who actually, and I know there's a ton of patients, but if you can get to a point where your doctor actually, within the 15-minute time frame that you would have with them or whatever time that you allot, let's trust. Let's work out a plan together. Let's hear together. And let's let both sides have a conversation to have an outcome that's going to be positive for the patient and for the physician. Because now you have to, as a physician, we don't talk about this very often. You, as a physician, anybody as a physician, you have this responsibility to serve a person, and their lives are in your hands. And if that person doesn't make it, or if the call was wrong and you said something, you have to carry that. That's a big weight to carry. And I wouldn't think physicians want to do that to people. Like, you don't want to see somebody die. So it's just so important that we recognize that there's both sides have to come to a middle ground balancing act to have a professional relationship with one another. But anyways, I really appreciate you sharing that. I do want to get into a couple more topics, and this topic is really on modern medicine and natural health and the truth in between, right? And that's what we're kind of titling this, and we're kind of going in that direction. You told me you're in middle road, and you said that just a little bit ago as well. And you use modern medicine when the data supports it, right? When there's studies that show and there's actual facts and evidence that this is what we have. But you also said that there's a lifestyle things that people can do that, might not be proven until the person actually experiences it and see if it works for them, right? When do you think it's appropriate? When do you think it's appropriate to use either one of those? Like, kind of give me an idea of, okay, somebody walking in your office and say they're ill with the normal American issues like high blood pressure, high cholesterol. Their A1C is literally pre-diabetes. They are their pulmonary issues. They have a hard time breathing. They're overweight, maybe 30, 40, 50 pounds. Like, where would you go from there with that person? How would you paint the scenario for them?
So I think, one of the things that I've been blessed with is the ability to read people and see where they are. And I think that's one of the things that's made me a good doc, because, I can kind of gauge, there's people like my mom who want to, in that situation, would want to be told, do X, Y, and Z. Here's a list, take it home, follow it to a T, and things will be good. And then there's some people that want to be involved in decision making and have some input into what we're doing, and be that pushback kind of person, and there's everybody in between, right? And so I think, again, being able to read people and meet them where they are is the key to success. So again, I think, being able to read people and meet them where they are in their patient experience with me is key. I find that the patient comes in for that initial visit where they have prediabetes or even diabetes, high blood pressure, high cholesterol, and there's a lot to do. Most people, that's the golden opportunity to make a lifestyle change, because a lot of us, right, don't want to be in that position. And especially if you start to know, hey, I have a higher risk of heart attack, a higher risk of stroke, a higher risk of all these other things, that, that this is my opportunity. I don't want to be that person, so I can change my lifestyle. And I've had patients come in full blown, their A1C is 14, their diabetes is out of control, they didn't have a clue, and, there they are. And I've had them change their lifestyle dramatically. Some stick, some don't. But I've had people, so that is the golden opportunity, in my opinion, to make people make a lifestyle change when they're scared and they know that they've got to do something.
That's called preventative medicine, what you call it, right?
Yep, correct. And again, some of my guidelines would tell me, if their blood pressure's over whatever, you got to give them a medicine too. I usually will take it as an opportunity. I'm going to give you a short leash here, depending on how bad the numbers are, 6 weeks, 8 weeks, 2 months, 3 months, whatever. I'm going to give you a short leash, but when you come back, we need to have the numbers better, because again, as a physician, I don't want you running around with your numbers in a range that put you at risk of something bad. And believe me, unfortunately, I've seen patients who come in then with a stroke because their blood pressure was too high, or they come in with a heart attack because their A1C was too high. I don't want to have that bad outcome, as you mentioned earlier, because I always do the right thing no matter what. That's, advice my grandfather instilled in me years ago. And so I try to make sure I'm doing for that patient what I would want somebody to do for my family. I'm going to try to make sure that we lower their risks as quickly as possible, but I'm not going to miss the opportunity to bring the lifestyle in. And I think that's key. Yeah.
Now, let's get into the topic, because it is everywhere for the last 2 years. Let's talk about the GLP-1 agonists. Let's talk about how these things are becoming something that you just like getting some candy at the candy shop anymore. I feel like they're being prescribed everywhere. People are talking about them everywhere. It's the new trend. It's like, man, I'm overweight. I can't do this by myself, so I'm going to ask my doctor if I can be prescribed a GLP-1, if you will. And it has been shown to really, I've seen people take it and they've done well. I've heard some people say, I'm never taking that again because of what happened. They have some side effects to it, and it's not good. I've seen people go on them and definitely lose muscle mass. And
so in women, especially women, guys too.
I've seen people do amazing, like I said. So tell me where this is going. This is kind of like newer. I mean, it's not new, really. This has been around for a long time. And technically, I think it's pushing. It used to be for diabetics, right? Like diabetics would be taking this, but now we found some evidence that it helps with fat loss and getting their appetites under control and things like that. Tell me where we're at in this field right now with the GLP-1s. Tell me, how would you prescribe it to a patient? Would you give it to every patient that comes through your door? And truthfully, is it needed for everybody? Tell me where we're at with that and where we're going with it.
Okay, so I figured we'd get to GLP-1s, the good, bad, and ugly of medicine for sure. So, I mean, obviously they do work. And so this is probably the first medicine, other than the old fen-phen and some of the stimulants that are out there, that really has made a difference in weight loss. And there's a newer one coming down the pike that's probably even better than these. However, they aren't without risk and side effect. And that's where I think there's a place for them, cautiously, but you've got to do your homework and you've got to do some preventive maintenance if you're going to take them to be able to come out the other side well. So again, they work. They do suppress appetite. People lose weight. The GI side effects are the real deal. So in my hospitalist role here the past year and a half, I've had at least a half a dozen patients admitted with the side effects, the GI side effects, either pancreatitis or nausea, vomiting to the point where they can't keep anything down, and you've got to reset the clock because these are injections that are in your body a while, so it takes a bit to get rid of it. So again, that's a problem for some people. And again, not a big deal because it hits you and you can stop it. Most people do get better, although there's a few that have persistent nausea, vomiting, and side effects from that. The biggest side effect, though, and I touched on it earlier, is the muscle loss and the bone loss. And again, if you think about what our problem, like my problem with weight loss is my metabolism is slow. Years of yo-yo dieting, years of me punishing myself, starvation, over-exercising, whatever I did at the time has killed my metabolism. And so like when you look at my basal metabolic rate, it used to stink. Now that I'm weightlifting, it's better, but it stinks. How do you get that up? Well, you don't take a GLP-1, I can tell you that, because you drop muscle and you drop bone. And so in women, especially women, guys too though, but in women, we can't afford to lose muscle mass and we can't afford to lose bone. And I really worry we're going to have a generation of people who have taken these that are going to get to their twilight years and be breaking their hips by sneezing. So now you're going to have to take medicines for your bone. For the diabetics, if I was a very morbidly obese diabetic, and I needed a little push and to get off that plateau and get going, and I had tons of insulin resistance with my type 2 diabetes, which I probably do if I'm a morbidly obese diabetic, I would consider doing a GLP-1 because I think that has benefit for me, a lot of benefit for me. However, I would be sure that I am doing a diet and exercise program that goes along with it. And the exercise for the GLP-1 takers must be heavy weightlifting to preserve what muscle mass you can. There's no studies out there, to my knowledge, or if there are, I haven't seen them yet, of, can you contradict the effect of the GLP-1s on your bones and your muscle by just weightlifting and exercise and lifestyle. I'm not sure. I hope there are. My guess is you probably can't, because if you look at the amount of weight that's coming off, the fat loss percentage is a small percentage. That's why when these people go off of the GLP-1s, you see an increase in their weight. It's pretty rapid and it's worse than where they started, because now you've slowed their metabolism and they can't get back to where they were. They're worse. And so, and again, who's going to want to take this forever, right? What if you get cancer and now you need to gain a little weight because your body's messed up and it needs it? There's just so many things that make me hesitant. And I know people want to put it in the water, and believe me, in the medical profession, we're prescribing it a ton. And I know my practice is prescribing it as well. I was in there filling in not too long ago, and I had a mom bring her young daughter in, and terrible lifestyle, and just give me the shot. And I'm like, I will not. And, I can tell you met with like tons of resistance. Like, I'm just going to go somewhere else. And I said, if you have to, that you have to. But I said, it is in good conscience, I don't want to hurt your daughter by slowing her metabolism at such a young age and putting her behind the 8 ball for the rest of her life with something that I know she probably doesn't need. And I can tell you, based on our diet and exercise conversation, if she just did the lifestyle I was talking about, she would lose the weight there too. And so yes, it's longer, and it, takes, motivation to get up and do it every day and to stay consistent, and you got temptation around you at that age especially. So yes, I know it's not going to be easy, but the GLP-1s aren't going to be easy either. I use the phrase sometimes in the stuff I put out, choose your hard, right? So do you want to have the hard be getting up and exercising and eating healthy and doing the lifestyle, or do you want the hard to be breaking a bone because your bones have degenerated from the medicine, or losing so much muscle and now you have to come off the medicine 5 years down the road and your metabolism sucks and so you gain the weight back plus 10 pounds? Like, I don't want to put people in that bad situation. So yeah, and again, there is roles for them. I am happy the cost is coming down so that the people that need them can get them, but they are not without harm. And I think one of the things that I try to tell patients who are on them that I'm talking to in the office is you must be in a weightlifting program to slow down the bone loss and the muscle mass loss.
That's so important. I do know that as well. And I work with people, I coach people, walk them through healthy lifestyle, right? And walk them through basically what you're talking about right now. So I find that GLP-1s, they're always that standby where like, I'm going to take these things, and they think it's this cure. And again, there's a season for everything for some people. I'm not saying don't ever touch those things ever, but I am saying, why do we make that a first line of defense where it doesn't have to be? And the good thing is this: when you do things the real way, when you try the healthier eating, you try the movement, you try drinking the water, you try the accountability, you do all the things, you are going to have such a blessing from that, not just physically, but emotionally, mentally, spiritually. It's an all-in-one package, because you miss out on the amazing things that happen during the difficulties of trying to become healthier. There is a lesson learned. There's a story that has now been developed that you can now be a witness to other people. There's glory to the Lord. There's so much. And I know we live in a culture now where we want everything yesterday. And the truth is, when you put hard work into it and you work hard to make something happen, you appreciate that gift, that outcome so much more than you would by just having something that's gonna, here you go, it's gonna help you. Yeah, it's going to help you, and you still have to do a little work with it. I shouldn't deny that, but still, when you do something the natural way as much as possible without an injection or without the help of something, there's a reward at the end that you can't compare.
Agree. And even the natural reward from exercising, so those natural endorphins are real, and you get them from weightlifting too. So yeah, I couldn't agree more. You have to do hard things to succeed, and whether it's in life or it's in the gym, you got to do hard things, and eating healthy and exercising on a regular basis will take you so much further than any pill or supplement actually out there.
Absolutely. Now let's move on to, we're talking about modern medicine. And in some places, in some locations, I know here in Texas, man, we have a hopping healthcare system, lots of hospitals, lots of medical professionals all around the place. And it makes it easy for patients to go find a doctor. Now, here's the thing. We're in a populated area. I'm in a DFW area. So we're Dallas, Fort Worth, and so many people. I love y'all, Dallas, Fort Worth, but there's so many people. And it makes it complicated sometimes getting into a doctor, but there are openings and new doctors and new practices pop up. Now we have places that are more rural and they don't have a lot of healthcare options. In fact, we have Bradford Family Medicine that is an amazing location, amazing place of practice, but we are capped out, right? We don't take any more patients right now. There are other practices in Bradford that are great practices, but they're probably getting capped out as well. Now we got to figure something out. But on top of that, there's emergency care that generation, the older generation and the unhealthy and whomever else, well, we're going to need that. Anybody is going to need, they're going to need some emergency care here and there. However, there is no longer a Bradford Hospital emergency room that people can go to. So now we have the Olean jaunt or journey, which time is precious for a lot of people with that, right? They may not make it to Olean. Can you give me your thoughts? I saw your post on Facebook a while back regarding the Bradford Hospital, regarding the closing. I just want to know your thoughts. Let's talk about this. Let's talk about this to our audience, and just tell me where you're at with this. Could it have been better? What's the next step? Like, tell me where you're at.
Okay, I knew you'd get into this, and this is a topic obviously very near and dear to my heart because my career has been at Bradford, and the majority, my 25 years of my 26-year career was at Bradford Regional Medical Center. So heartbreaking and sad is how I would define it. So I think, I made some comments earlier about the larger state of healthcare, though. I think this is one of the downsides to the consolidation. 15 years ago or so, there was this push to consolidate. Bigger's better. You got to scale up. You've got to get these big networks. And all they did was create big bloated administrative networks above you that are not directly involved in patient care, but are managing or administrating patient care. The actual patient care has gone down. So to give you some reference, when I started in Bradford, we had 15 primary care physicians. It's a heck of a lot less now, not even half. And obviously we don't have a hospital, so a lot of the other services and stuff have evaporated as well. Do I think it needed to be that way? No, I don't. And as many know, I took a 3-year stint as an administrator, first as CMO and then as the CEO of the health system here, the president and CEO of the 2 hospitals. I don't think it was necessary. I think it was a business decision. I think the decision had been made long before I was in that role. And the fact that I was starting to show them that it could be done was something they weren't willing to continue with. And so that's why we are where we are. But so do I think it needed to happen? No. I think what I will say, though, is I do think rural hospitals need to reinvent. So much like what we've talked about in some of these other topics, the healthcare system has been a sick care system, and hospital systems are completely a sick care system. You don't even get healthy food at hospitals. I hate to say that. I love some of my dietitians and nutritionists that I've worked with and the cafeteria folks, but they don't serve healthy food at hospitals, and it is what it is. So you're not getting well care there, you're getting sick care. You come in with your heart attacks, your strokes, whatever other things that ail you, and we fix you and send you out, or you have a bad outcome and you don't make it. And that's what the health system, hospital systems are designed to deal with. I think we need a transformation in that. So if you look at, utilization rates, and I don't want to bore your audience and make them all fall asleep here, which this topic, if I went really deep in it, would. We have in this country, especially the northeast part of the country, we had more people admitted to the hospital than really needed to be. And when I started my career 26 years ago, the hospital beds were full. People stayed weeks for pneumonia. They had their gallbladder out and stayed a few days. Now, almost all those things are treated outpatient. And if you do need to come in for pneumonia, it's a couple of days, antibiotics, and you're out. And so the way we treat patients is so much more rapid and better, to be honest with you. Patients are getting better, faster, better care. Like my grandmother, the first time, so when I was 11, that was a long time ago, won't tell you the year, but she was in the hospital for months after that bypass surgery. Now, if she had bypass surgery today, she'd probably be in the hospital less than a week and home. That's better because she's not laying in a bed, getting weaker, and having bad outcome because of the stuff that's being done at that point. So getting her in and out, getting the procedure she needs and out is the way to do it. But as a result of that, you had hospitals then like Bradford that had tons of patients and were full. And now all of a sudden you're not keeping people as long, gallbladders aren't being kept overnight, stuff's being transitioned to outpatient, so they don't have the revenue, but they still had the same, system, the same care team. And so you got to downsize that. That's painful. Nobody wants to lose their job. They don't want their job to be reinvented or, things change. Nobody likes change, but it had to be done. And so I've over 26 years watched that happen. But I think what happened, though, is we got to a place where we found balance and we could succeed in the new world and the new payment system. But then that wasn't enough. And so here we are. Now, again, rural hospitals across the country are facing similar pain. But I think part of that is they don't reinvent themselves well, or they have a big bloated administrative system siphoning too much off the top. And I think we have to get back, in my opinion, to putting the patient care dollars, so either your insurance or government dollars, whatever's feeding that, into the doctor-patient relationship, the actual care of the patient. So when you go get an x-ray, the x-ray gets paid for. When you see your doctor, that doctor visit is paid for. When you go to the ER, that ER visit is paid for. And they know what the overhead is. So I know some of these systems are charging exorbitant rates, and you don't get to know what your bill is until weeks later, and then it's way more than you thought. And so price transparency, putting doctors back in leadership roles, all of those things I think need to be a necessity. to retool the system. And if you start to put the money into the actual care of the patient, the system will right itself. The whole ship will right itself, because you'll all of a sudden having the money be dedicated to what's needed. And I think, again, part of what's killed areas like Bradford is, over my 26 years, my practice is the only private practice, primary care, left in the community. And it's because it pays so poorly. That my payment, people think, well, we don't want doctors getting more money, but the payment that comes in for your 15-minute office visit doesn't pay me. It pays my front office staff. It pays my back office staff. It pays the rent. It pays the pharmaceuticals in the refrigerator. It pays the lights. I mean, whatever bills I have to run the office, that's what it covers. And it's shrunk down over 33%. And I just read today, actually, CMS released their new rates. It's going to go down another % or 2. And so, you keep cutting what the value is for me taking care of people. You can't expect then that I'm going to stay in a business, because the business model is broken. So I'm either going to have to shift to concierge medicine, which is basically, you've got your insurance, but I'm going to charge you cash to come see me. I don't want to do that, especially to this area that's crippled already by lack of care. I don't want to do that to the patients in this area, but I'm not going to have a choice. I'm going to have to stay in business, because it's not fair to us to keep taking a cut, which is what I've done, that's why I'm doing hospitalist medicine now, because that's the only area that gets paid enough for me to sustain myself. And so, and be able to help support the practice. So, those kinds of things, if you rewrite the payment system and put the money back where the actual doctor-patient relationship and where the care is being provided, I think you would go a long way to fixing the entire system. And having said that, I don't think we're even close to that being on anybody's radar. I think, the insurance giants are out of control. They don't, paying more than we've ever paid, more than my freaking house costs in a year. We're paying that to insurance companies to get a family plan for our insurance, and then when you go to get care, they don't cover anything. You have to pay another $10,000 out of pocket to be able to get the care you need. That's ridiculousness. And again, it's administrators in those entities too. We got to stop paying for the administration of healthcare, and we've got to start paying for actual healthcare, the delivery of healthcare. And we'll see. And then again, this is one of my soapboxes. This is one of the things that drives me. It's why I tried to get into administrative stuff to try to fix it, and I found myself hating every second of every day at that job. So now I'm out, which is good. But hopefully in the rest of my career and before I die, I will see it change back to something that is better for the patients that we serve. And I think you'll find the doctors and nurses will all be happier too.
Wow, thank you. Thank you for sharing. That's a lot. You definitely run a soapbox there. But, when something is near and dear to your heart, you get passionate about it. And I really appreciate you just being, transparent there and just sharing your heart and where things are at. I look at a lot of places around my area. I think you would call them direct primary care. So these are places where people can get memberships, if you will, for a PA to look at you or to check you out and then refer you to a specialist at a cost, which then here we see probably that is more sustainable than what is up and coming to the primary care places, as I'm kind of seeing. Would you agree with that? Do you think the model is? That's a model that's working, it seems like. People are, yeah. These places are doing well.
Absolutely. And again, that is the model that they're forcing us to either be employed and you can take care of everybody, or be in a direct primary care or concierge model where you take cash. And, again, Dr. Stupak and I, we're local girls. We are popular. We could get away with it. I have enough patients, and I'm sure she does too, that we could have a cash pay system. Who does that leave out? People who can't afford it. People who don't have coverage for it, you won't have coverage because you're going to be paying out of pocket for that. So the poor patients in the community are going to suffer, and this area is poor. And again, I didn't go into medicine because I wanted to make all this money. I went in because I wanted to help people. And so I'm going to be cutting off a huge portion of the people that I want to help. I want to help all of them, the wealthy and the poor. And so the fact that medicine has forced us not to be able to do that just pisses me off, to be quite honest with you. I want to be able to take care of everyone. And that's the only reason we haven't done it. Again, because it's getting harder, and every year our reimbursement goes down. I hear about these people out in California making millions of dollars on some scam they did with the government. My God, I get audited if I charge an extra code or something that's worth $20. They're in my office, like getting it back the next day. I can't understand how this kind of fraud is going on when you have people literally trying to eke out a living as a primary care doc and not getting paid. It's ridiculous. And so it is what it is. But I think the direct primary care model, the nice part about that is it makes you provide value for what you're doing. Now they're not paying the insurance company, which when people come to my office and they have insurance, they think that what I do should be expected and I should do it for nothing because they've already paid on the insurance side. And whether I provide great care or terrible care, they don't care. They expect certain things. But when you have a membership like a direct primary care concierge, I now have skin in the game with you because you're paying me directly. And so I have to provide a service. And I would love to do that if it wasn't for the fact that I would be cutting out a quarter of my patients that are poor. And that would just break my heart to do that.
Yeah, you got to have a patient-centered focus, and truthfully, any type of physician or anybody in the medical field or health field, you really have to see a person as a person and not as a number. And that's what separates a good physician or a good health advisor or someone versus someone just doing it for a paycheck. Because yeah, you could easily do what you want to do. I mean, you're recognized in the area. You could certainly do what you need to do there to make ends meet and then some. But again, to what extent and who is going to suffer because of that. I think there's eventually going to be a way to please both, but I think that's to be developed pretty soon. I do think there needs to be some of that development as time goes on because it isn't sustainable. There's just no way. I mean, healthcare systems are not improving. Their health insurance is not improving. I mean, treatments are. With more treatments and new technology in a treatment world comes additional payments that go with your premiums. Like, okay, insurance is going to cover a scan that costs $20,000, right? I mean, it might cover some of it, but now because it's much more expensive, that comes out of pocket as well, and as time goes on. So I see, and I might be wrong in some of that, so please correct me, but I see if technology seems to advance, health insurance keeps going up, they're not covering as much because, hey, that's too expensive for us to cover, and we have millions of people on healthcare. There's going to have to be a breaking ground somewhere, somehow, someday. There's just no way you can sustain all that system.
Yep. I agree. And, there's various opinions out there. So, some people think let's do a government paid system, but nobody wants to be on all Medicaid or all on the VA because those are two government run healthcare systems and they're both bad. They don't pay well. Nobody wants to stay in them. And you can look at Canada and Britain and some of the challenges they're facing now. I don't think it's the right thing to do either. But you can't have what we have. What we have now is the worst of the free market, right? So again, you have these big bloated administrative systems that aren't providing care. They're just collecting money and pushing pennies around the table. You got to get the money back to where the patients are. And I think, what would fix that is allowing competition again. So we've set it up now so that you have these entities and areas and they control everything. And then everything was consolidated up through those. And so, your docs can't just open a practice and practice because, one, they're not paid to do that anymore. And so they're in a system, which then the system sets the prices and they set the prices high. That $20,000 scan you were talking about, if there were 5 people that had one in this, northwestern Pennsylvania, patients could pick which one they wanted to go to, and it would probably be the one that cost the least and provided the best outcomes. Competition would drive that down. And that's kind of where we have to get to, I think, again, to write the system back. But until we fix the broken payment system, you're not going to fix that.
Yeah, and it's true too, and they're popping up. Let me tell you what, and around this area, I mean, MRIs are expensive. Okay, like that, and you could actually get one out of pocket. There's facilities around here that have MRI machines that you can just make an appointment, and your doctor doesn't even have to refer you. Technically, you can get these things completed, and there's certain days of the week that they're not half off. They're like 20% off or something like that. It's like, because I looked into a couple of them before. I'm like, wow, how much is that going to cost me? And so anyways, in the rural areas are really going to struggle to make that a thing. Okay, so it kind of goes into really going back to natural health. Modern medicine has a place. It certainly serves the individual. It cleans up a lot of messes that people have made over their lifestyles. Let's be honest. Like, there's a lot of that, which I think technically we are in a place where people are more sick than they need to be. A lot of it's from just bad practices. Some of it you can't help. There's genetics involved, and there's things that just happen. You can't do anything about certain things. Like you were saying, you could have a heart attack tomorrow. Who knows? But you can do everything right today, at least, to help prevent some of that. And unfortunately, we kind of go to, like you were saying, we go to sick care instead of preventative care a lot of times. I think the biggest thing we can do right now as a listener, as a patient, is truly to take care of ourselves, to truly do the best we can with everything that we have, to do the best we can for our health. And that's move your body. That's stop with excess sugar. That's let's ensure that we're eating more natural instead of so much processed. Let's ensure we're eating some fruits and vegetables and healthy proteins. Let's lift some weights. Let's, you name it. Let's get good sleep. Let's try to stress less. I mean, again, I'm not a professional in the medical realm, but I would say that would probably knock down patient care pretty significantly, at least for a good season of people's lives, and therefore would probably be better for the individual. So that's where natural health comes into play, that I certainly believe could help really open the door for people who really do need to care, instead of us being just, not taking care of ourselves, for being, hey, who cares about our health? Don't wait until it's all said and done to where you develop now you need a stent because you developed, a clogged artery of some sort, right? And things like that. So as we close, I know we're kind of going over time here, but as we close, what's the best advice you can give a patient who, man, just like they need some of that guidance, right? Natural medicine, natural health versus modern medicine.
Yeah, so it's all about the lifestyle, and that's where you need to start. And I can tell you the hospitals are filled with people who don't follow a healthy lifestyle. They're out of shape, overweight, and they've got all kinds of health problems. If you want to prevent that, the key is really to eat healthy. So we talked about eliminating or limiting as much as you can the processed food. Eat real food. So real meats, real vegetables, real fruits, things like that. If you're going to eat, pastas and different things, try to make them yourself, or, buy something that's made freshly instead of packaged in those center aisles in your grocery store, mostly processed foods. Eliminate those as much as you can. Exercise is key. Again, people who live long, healthy lives and have good quality of life, so are able to get around and do the things they need to do, are all active people. No matter what culture you look at, they're all active. They all have different versions of exercise, but I can tell you they're all doing something to increase their muscle strength, and they're doing something to improve their cardiovascular health. So walking, you don't have to be a marathon runner. Walking, be physically active, avoid sitting, try to get up at least every hour if you can and walk around. Sitting is the new smoking, so don't sit on your butt, get up and move. Sleep is important. Making sure that you're focused on your mental health is important. For me, that's getting outside and spending some time in nature and doing things that you find enjoyment, and relationship building with your friends and family. I think there's good data to show that, the relationship connections you have with folks improve your mental and physical health and well-being. And so all of those things super important. You don't have to take supplements. I think a lot of people, when they think natural, they immediately, there's a natural product that's going to help me. You don't need products. You don't want to take medicines, great. You don't need the natural stuff either. Do the lifestyle stuff first and foremost. If you do that, most of what you're working towards is going to come regardless. And then, like I said, it is about balance. So if you do get something bad happens to you, catastrophic health illness, cancer, heart attack, stroke, something like that, find a good doctor and go with the evidence-based products that are out there, evidence-based medicine and care, to make sure you're getting what you need. And you've got to balance those two out. But I will tell you, again, in the hospital world that I see patients in now, if you're doing the preventive stuff, most people don't end up there.
I mean, it's quite obvious that as you're a physician, you do see that. But I mean, just as a patient, as a person out in the health and wellness field, man, if people just knew, right? If I'm a coach on bias, I love it when people hold you accountable. And if you don't want to coach, find an accountability partner, do it together. Really, you can make this like a fun thing with people. You can really just change your life. And it can start with one step at a time. I mean, if it means just cutting out the soda and the sugary drinks, like right now, my mom, she has to be careful with sugar due to liver issues and things like that. And I'm putting it out there because her and I talk about it and she's very open. But, one thing that she could do, the best thing she could do right now is just give it up. Like, let's get the processed sugar out of there and let's just treat her body with respect. accountability goes a long way with that. I check in on her, once a week or so. Hey, how's that sugar intake? Okay, I only had one this week. Okay, great. Things like that. But you can take things into a level where you have the accountability, you have friendships, you develop partnerships, you develop just fun, do this together, health and wellness journeys with people. And there's a social element to that.
Absolutely.
You grow in community, just like Dr. Owens, like you were saying. I'm sure you have people you work out with here and there, or you have a relationship with people that do, right?
Yep, absolutely.
It's great for you. So very good. Well, I really appreciate your time. We talked about so much. I could probably ask you a million more questions, to be honest, but I want to make sure this is something that they can listen to in a timely manner. But thank you so much. Now, before I let you go, is there any way people get in contact with you if they have any questions or anything?
Sure. So I do have a blog online if you go to bradfordfamilymedicine.com, you'll find my blog on there. I'm on Facebook. I'm on LinkedIn. I'm on, actually, I just got on TikTok. Believe it or not, I'm branching.
You doing some dancing on there or something, or what are you doing?
No, all health related stuff. So actually, one of the things I hate is being on camera. So the fact that you got me to do this, kudos, Justin. So I hate my face on camera. So you won't see me doing many TikToks. Although maybe at some point I'll change my mind. You never know. But yeah, no, I'm out there and happy to give advice to folks. I do try to keep it real. I know you can't do everything. Rome wasn't built in a day. So find things you're doing that are terrible and make little changes until you get to where you want to be. That's the key.
And we'll put your tags in our show notes, and we'll put some information in the show notes regarding Bradford Family Medicine. And of course, some of the show notes will contain some of the information that she shared today on how to get healthier. And guys, listen to this, share it with somebody else. And really, Dr. Owens, it's been beautiful to have you. Thank you so much. And guys, we'll catch you next time on the 600 Pounds Down podcast.